Justin Shore here from Chronicles of EMS with another 60-second life-saving tip. Today, the Happy Medic's suggestions for an easy first aid kit. We're going to look around the house and grab some things to have handy in case something goes wrong. Number 1. At the store, grab a box of assorted Band-Aids. Big, small, round, knuckle. You'll probably need them all. Right next to those is going to be a small package of 4x4 bandages in separate packages. Grab one of those as well. You're also going to need a bottle of hydrogen peroxide for small cuts and scrapes. You also want to keep by the sink some antibacterial soap for washing small cuts and wounds. You should always wash those with warm, soapy water. Let them air dry and then apply a bandage as appropriate. But the most important thing in the Happy Medic toolbox, first aid kit at home, is a bag of frozen peas. Makes a perfect ice pack for those aches and sprains. Always apply ice 15 minutes on, 20 minutes off. Don't apply heat in the first 48 hours. And if pain or discomfort continues, contact a doctor. Of course, if you pass out during any of this, give us a call at 911 and we'll be right by. Until next time, this is Justin with another 60-second life-saving tip.
I think as well we need to look at like outcome measures. I don't know if I cannot see how your service can be compared with yours as far. I mean, we have national league tables and everything. We know exactly where we stand against the other trusts in the country, and what we're trying to do. Yeah, but how do you judge that? Well, because what we're trying to get away from and move towards is we want to be judged by our patient outcomes at the end of the day, not about times or about financial bottom lines and stuff. Maybe it's over here, and until your service can then shout its praises about itself, because you know we're so good because we didn't take everyone to the hospital. We got the people to the correct places to be looked after, and they were very pleased with that service, and you know they got top-notch service. Until something's done, that can be what you can shout about, and that can be what you can compare yourself to other services. It's hard when how do you compare each other? How do you compare against trusts or services?
We can't even get cities to agree on what a good metric is. I mean, they can't even define return to spontaneous circulation the same in most places. You know, does that mean pulses in the field? Does that mean pulses at the scene but not in the ambulance? And we don't.
It means whatever it is, you can get your numbers high enough.
Exactly, whatever looks good. You know, when we were trialing some equipment in my service, you know, our numbers skyrocketed. It was wonderful. It was great. We had great numbers. And then the equipment went away and our numbers went back to normal. And then you talk to people in other cities and they're saying, oh, we've got a 91% save rate. How do you have 91% save? It doesn't work. Well, that means you transported. Well, you know, that doesn't work. So I think when the cities start talking to each other on the same, see, they're talking to us now. When cities start talking to each other using the same language, using the same numbers, then we can set up that metric and start comparing and start seeing, well, you know, Wake County's advanced paramedic program is great. It's doing a lot of things I'd like to do. Is it working? Well, in what manner? You're exactly right. We don't know how to metric that.
And how do we sit down with our city fathers, with our county leaders, with our local politicians who don't understand what we do and don't have time to understand what we do, and say, we'd like to use this program, and it's going to be an initial outlay of cash in roughly this amount, but we believe that you can get a benefit from it. They're going to say, wait a minute, we just want an ambulance to show up when people call 911. Yeah. And that makes us happy. That makes the citizens happy. How do we find the way to convince them, those local politicians, that this is the way it really should be, and we know this because of this, and here's our research and here's our background? I don't know how. I haven't figured out that magic bullet yet. But if I could go tell my county leaders back in my rural county, hey, I'd like to implement this program tomorrow, and here's how we're going to fund it, here's all this stuff, here's why it's going to work, and here's what it's going to save you in the long run. We're golden. We're golden because we fixed the political issue.
Well, talking about political issues, CB in the chat room is talking about, saying he doesn't want to make it political, but and this is something I still really don't understand that much about, but how is the healthcare reform, if it goes through, going to affect this?
Not at all.
You know?
No. No. Not at all. That's
because everyone around the world, or certainly in my group, we all think what you're striving for with the healthcare reform act is free care for all. You know, and you've explained to me that that's not what it's about. And
it's free care at time of service. but it's not free. You know, that's one of the big political rally cries, and I don't want to go too much into it, but the fact that my employer is paying a higher percentage for my health insurance than I would be paying an increase in taxes for the same service, it's ridiculous. I'm paying more to a private company to provide what another agency could theoretically provide, we don't know, for less. And that would mean either more money for me, for my employer, for my municipality, who knows. But there's a very strong feeling that the system could work if it's tinkered with a little more. And if we just worry about adding more regulations and adding more hurdles, that we could get it working our own way. And we don't really know what'll work.
I have a different opinion on healthcare reform, and if anybody thinks that I'm going to sit here and solve the healthcare debate in the forum,
well, that's why we're here. The three of us are going to solve it right here, right now.
Excellent, excellent. Do we got time? Because
President Obama's going to be here in 10 minutes. He's going to sit there.
Is he?
Yeah.
All right. I thought he was going to sit to my right.
we'll have to go to stool.
Yeah.
But I'm for a market-driven solution to healthcare, and
Why not the patient-driven solution to healthcare?
Patient-driven solution, market-driven solution. I want more patient choice and the patients to have options to purchase their healthcare in a way that suits them. Or if somebody wants to be more prolific consumer of healthcare choices, that's fine. They're going to have to compensate the healthcare providers that are paying that are providing that care. I'd like to see the healthcare be priced fairly so we can actually feel what our healthcare costs are. With your private insurance, you don't feel what your costs for healthcare are, and you have no idea what the insurance company is actually paying. If we were all more educated consumers on our healthcare, we could see where the savings were and tweak the system through actual consumer-driven choice rather than the heavy hand of the government. I came up with the idea of paramedics providing the annual physical. I wrote an article on that some time ago. And the primary care physicians have said that the annual physical is an unnecessary cost. They spend somewhere in the neighborhood of an astronomical sum that I don't remember the exact number on providing the annual physical. And the primary care docs have said that's an unnecessary cost for not a lot of benefit. So they'd like to scrap the idea. It's a debated topic in their circles, but they'd like to scrap the idea of the annual physical. I say that's a great opportunity for paramedics to come in and provide the annual physical at a significantly reduced cost. We may not give the full in-depth assessment that the physician's going to give, but we could pretty much hit the high points and screen out the diseases that are going to kill somebody over the short to medium term. Now, that's a huge cost savings, but why can't we do that? It's because the government says and regulations say we can't do it.
And doctors groups say
And
we can't do
doctors
it, and
groups.
nursing groups say we can't do it.
Yes,
Is that
that too.
because paramedics and medics aren't seen as the same professional level as nurses, and we're
Exactly.
still
That's-
down there, you know?
And that's and bringing it all back together, and that's what I think we're trying to do with this idea of EMS 2.0. Bring up the education, bring up the response standards, but also bring up the standards that we hold ourselves to. You know,
Absolutely.
for too long, it's been, I mentioned it on the blog, you know, the days of the you fall, you call, we haul, that's all, it's over. We're done with that. Throw that out the window. If that's how you feel in this line of work, go get a job at Jack in the Box before you hurt somebody.
But what we have to do, what's needed is
and
there's
I
still
love
a
Jack
lot.
in the Box, by the way. So go ahead.
Had one this morning, but there's still so many of us out there who hold that view, right? And as bad as it sounds, if you think of them as holding back on EMS 2.0, what we hope to achieve, you know, we want to be seen as professionals, and the three people around this table are professionals, and there's a lot more people out there who are professionals, and there's other people who hold exactly the same rank as me, training as me, job title as me, who aren't professionals. And sometimes it's the damage that a couple of people do and it goes back to the simplest of things, you know, being proud of yourself, being proud of what you do, dressing correctly, holding yourself correctly, speaking properly to the patients. And there's still, in the UK, there's still very much this view of a paramedic is like, he's the bloke next door and he has a laugh with the patients and stuff, and that's lovely, and the patients enjoy that connection on a human level. But there needs to be that step of, yes, I'm here, we'll have a laugh, but I'm also a healthcare professional, and I'm going to look after you. And that's what you saw, which I thought was, when you came over with me and worked with me, one surprise thing for you was that I could say to people, I'm going to arrange for you to be seen by the district nurses tomorrow. But I think what surprised you more was that they accepted what I was saying.
Yes.
You know, and whether that's, because that needs to be a whole change on the citizens and the public as well.
And it's very interesting. What I saw was my clientele expects a ride. They feel as though it's their right to have a ride, and yet where you are, where everyone has, you know, no cost at point of service, everyone respected your opinion. Everyone waited to make a decision until you talked to them. Where, like you saw, a lot of my clients, they've already got their mind made up, bags packed, they're ready to go to the hospital. I have no choice but to take them. It seems like it would be the opposite, where since my people have to pay for it, you'd think they'd be more welcoming.
But they don't.
Yeah,
to stay home.
You don't.
But they don't pay for it.
They don't pay for it.
And that brings us all back into the reform issue. But honestly, Mark, if we went to single payer health like you have tomorrow, if they just waved a magic wand and it worked, I don't think my job would change one iota. Yours?
It might. I have a lot of population. The rural areas I've seen are flipped from what you see. Sure, we have our system abusers that call us 10 times a week for the same problem. We have the same diabetic that we sweeten up every morning. We have the same, I hurt my back and I have to go. Not that those aren't real medical complaints. However, they're not best handled by a lights and sirens ambulance response. But what I see in my area is we have the rural people who will wait until the absolute last second to call 911 because they don't want to bother us, or they don't want to waste our time, or they're just too proud to seek medical care. It's very common to sit down at the local coffee shop in a small town and hear, "Oh, did you hear about Dave? He wasn't feeling good, and turns out he was having a heart attack. He died." And every time I hear that story, and I hear it a lot, I say, why didn't they call me? Why didn't he call me when he had chest pain?
Yeah.
And this is a common occurrence. I mean, I speak of the ambulance chief in a neighboring jurisdiction years ago when I was working in another state that died from a sinus infection that abscessed into his brain because he didn't access medical care. He didn't have a primary care provider. And when he got really sick, he didn't call the ambulance until his wife found him unresponsive. That's the problem we have there, and I don't know if it's...
But what stopped him?
I don't know.
Was it his education? Was it his lack of insurance? But Justin's already explained that you're entitled to emergency care,
Absolutely.
but you have to pay for it after the fact?
Yes.
Right, so that might have been a barrier as well. Or it might have been the fact that he was a stubborn, proud gentleman who didn't want to bother anyone.
Farmer.
It's hard to tell.
It's hard to tell.
Our clientele, our service base, doesn't know what we're capable of. We've spent the last 30 years not telling them.
And we have just changed in the last 6-7 years to what we can do now. And we still get, go up to a GP, a primary healthcare physician that you would have here for a chest pain, and we'll go in and we'll do a 12 lead and transmit it to the PPCI centre. Or up until a couple of years ago, we were thrombolizing, and the GPs didn't understand what we could do, and they're directly linked with us. And we actually had to put a education program together where someone from our service went around all the GPs and said, "This is what they do." We even used to get calls still a couple of years ago when we're advanced practitioners now, and it was like, "Yeah, we need to do a transfer. Do you carry oxygen?"
Yes.
And this is from people who are meant to know what we can do.
Well, a lot of physicians aren't familiar with the King tube. When the King tube comes into their ER, I had a chest seal on a sucking chest wound. He said, "What's that?" I said, "It's an occlusive dressing." He said, "A what? Take it off." I didn't know you guys could do that. Well, doc, it's a sticker with a window. So.
I had a recent story, and this speaks to the amount of education that we have to do. I responded to a physician's office somewhere in the world, and for chest pain. And when I finally found the physician, the nurse told us what the patient, told us a little bit about the history, and as my partner was packaging up the patient, I found the physician, and I asked what was going on with the patient. And as I'm doing this, I'm flipping through the paper, and I see 4 boxes of ST elevation and 2-3 in AVF. And I say, "Oh, so this is a stenting. This is an ST elevation myocardial infarction. This is a big heart attack. What did you do?" About an hour ago, I gave her 325 milligrams of aspirin. And it's all about the 90-minute door-to-balloon time, or the onset of symptom time as measured in my service to cath lab. And
the new golden hour.
This physician felt it necessary to hold the patient in their office for an hour
Most of
or
that time.
more.
Yeah.
And is that a public education issue that that's the responsibility of the ambulance service? Obviously it is. If we're out for the best aspects of the patient, obviously that's something we have to educate on. And the ambulance industry, we have to be our own biggest mouthpiece. We have to be out there talking to people. And
But we are the worst of all the services to promote ourselves.
oh yeah.
And I know that's not just an English thing, that's across the
And
world.
that's just because of our history. We've never had to promote ourselves. Why? Because everybody calls us. Everybody knows we're going to be there within 8 minutes. Well, time's aside and ambulances aside.
Yeah.
But,
So have we solved it?
have we solved it?
Have we solved it?
Absolutely. Yeah, the universe is one. But I'm very excited. I've got 23 years left in my career of EMS. And I'm very excited to see where it goes.
I'm gonna have to work until I die, two full-time jobs, because I work in the rural areas where money's very tight. So
Come down to the big scary city. We're throwing money at paramedics right now.
hey, that'd be awesome.
Great. Gentlemen, fantastic.
Thank you very much.
Thanks for having me.